Well, my name's Lauren Wilkenson, and I'm a labor and delivery nurse at Sequoia Hospital in Redwood City. I entered nursing from the field of marketing and business. I found out about the nursing program available through Kenyatta College, and so I came here to Kenyatta. I took my classes here. It was funded by Sequoia Hospital Foundation, and I got my degree through San Francisco State, and then I became a nurse. I actually wasn't able to get into the community college program. As a nurse, you can do a 2-year program, which is an associate's degree. You can do your bachelor's degree, your master's degree, and there's degrees beyond that. I didn't want to do the master's level because I wanted to get in, get out, and be able to make some money and live as an independent professional woman. And I actually thought, well, I'll do the quickest, the shortest program first. And so I looked at the community college associate degree program, and I was rejected. And I was told off the books that because I had already had a bachelor's degree, I wasn't going to be allowed to enter that program. That their feeling was that the associate degree program funded by California was really for people that hadn't had the opportunity to have a degree of another sort. So because I already had a bachelor's degree, they felt it was more appropriate for me to be in a program where I would get an additional bachelor's degree. Some of the professors they have I took my classes through College of San Mateo and at Kenyatta for my prerequisites. Teachers at the community college level are really enthusiastic, really want to teach, really want to be there, really want to engage their students. In terms of once I was in the nursing program, done with my prerequisites, I think the thing I liked best was the clinical rotations, particularly at Sequoia. Sequoia has an interest in our education. They're hoping to kind of groom their own nurses so they get a top selection when those nurses graduate. It's great to be learning in an environment where you're feeling supported and feeling like the people that are running the program really want you to do well. And coming from the corporate world, it was a big shift for me. So instead of going to work 5 days a week, I go to work 3 days a week. And I do 12-hour shifts, and those are 7 a.m. to 7:30 p.m. And it's with a half-hour lunch, not a lot of break time, not a lot of downtime. So I sit down from 7 to 7:30 and get reports so I know what else is going on in the floor. That might mean at 7:30 I pop up, I get in a room, and I assist with the delivery of a baby. I might be helping with an induction. It involves a lot of teamwork, working with the other nurses. It involves a lot of communication skills, working with the doctors. So I'm constantly managing the labor, keeping the doctors in check. I take my orders for them, but basically I do all the kind of preparation for labor, and right when that baby's head's about to come out, the doctor flies over from the offices, which are right next door, and they catch and deliver the baby and take care of the mommy afterwards. So if I'm not doing labor, I'm working in postpartum and taking care of the mommies and the babies after they're born. Of course, working to incorporate the husband or the partner that's there, doing a lot of education, also traditional nursing stuff like passing medications, and again I said vital signs, but a lot of education is involved in postpartum. And the other interesting thing I like to say about labor and delivery, it's a lot of disaster preparedness and emergency management. Because it's very much like the ER, you never know what's going to walk through the room. When people get sick in labor and delivery, things go bad very, very quickly. So you have to be constantly prepared for the worst that can happen and then hope for the best. It sounds funny, but I like working with my hands and working with my body. When I was in business and marketing, I spent a lot of times, particularly when I was doing business development, sitting in front of spreadsheets and adjusting numbers and on the phone and setting up meetings. And this, I'm actually using my body. I'm helping patients get up. I'm helping them get into different positions. We're getting in the shower. We're getting out of the shower. We're getting on the birthing ball. we're changing beds, we're holding the babies, touching the babies. There's a lot of physical interaction, and that's really rewarding for me because not only is my brain stimulated, but also my body is stimulated. I'm a kinesthetic learner, okay? And so I find that nursing really meets a lot of those learning needs for me because I'm doing hands-on teaching and hands-on acquisition of knowledge all the time too. Financially, it's very rewarding. The schedule is very flexible. You can work nights, you can work days, you can work 8-hour shifts, you can work 12-hour shifts, you can work evening shifts, so there's lots of flexibility. And the amount of discipline it takes to establish a work-life balance, you've got to watch your body all the time, your shoulders, your back, but it's also your brain. And so you're there and you're really present, you're really interacting, but it's really easy to go to your job and just give absolutely everything you have, and then at the end of the day, fall apart on your family. And so being able to go home and find, you know, whether you're doing yoga or soccer or dance or art classes or whatever you're into, so to achieve that balance so that when you go home you restore yourself, so you're able to go to work and give 100%, but also balance your day at work so that when you go home you're able to give your family an equal amount of energy and love and passion that you provide to your patients at work. The advice that I give to prospective nursing students is it's very particular. There are some classes provided in the community college system that are not particularly well known. They're very small classes. Mine I took at the College of San Mateo, and they were weekend courses taught by a PhD of nursing, and they were on things, it was like intro to nursing, or it was introduction to pharmacology, or introduction to nursing math. These classes weren't very expensive. It was a very short amount of my time, but what it did is these classes exposed me to some of the ideas and theories and lifestyle changes I was going to have to make and adapt for nursing. So that's one thing. I'd also say before you start nursing school, before you go to the dentist, go get new glasses, go see your doctor, get all those kind of things out of the way. Arrange your child's care so that when you're in school, you can really, really focus on school as much as possible. Something else that people don't realize, which is kind of a hidden secret, is that an RN is an RN is an RN. All you've got to do is get through and pass. You do not need an A+ in every course. A's are great, especially if you're going to go to grad school eventually. But just do the best you can, but don't stress out too much in any one particular course, because when you get to the end and you sit for your NCLEX and you pass that NCLEX, no one's ever going to know your score. No one's ever going to care about your score. You're actually not going to find out what your score is. It's whether you passed or didn't pass. So unlike, you know, sometimes people say about, you know, business school, you've got to go to the #1 business school to get the #1 business. This is not like that. As long as you've got your license, you can practice anywhere in the country. You want to practice outside of the country, you can practice on any American military base you want to. There's just so much opportunity once you have the RN. The other thing I would want people to know is the amount of, and what's very attractive about the profession is that there's so much lateral movement you can make. So if I get kind of burned out or bored with OB/GYN, I can go and study to be a med-surg nurse or a psych nurse. I can do, if I don't want to do clinic work or hospital work, I can go to work in the clinic. I can get into a specialty like fertility, which in this community we see a lot of IVF, in vitro fertilization. There's just so, and there's like the business side of nursing and the administrative side of nursing. There's the clinical charge nurse ladder. There's just a bunch of, it's like a tree. And so once you get in that door, there's so many different branches you can go out on at different points of your life. And so many, it's not just like a set career ladder. There are many different routes and paths available to you once you have your nursing license.